FORA.tv. The world is thinking.
I don't want a mandate because mandate's not working in Massachusetts right now. That's the one example where it's not worked, and I don't see where you're going to force people to have health insurance is really going to work. I'm not opposed to it. I just don't think it's the most practical way. I would like to lay out all of the opportunities for a person to buy it, and I think you can convince with a $2,500 income tax rebate or a $5,000. You don't get it unless you apply for the health insurance. Most people will take that in a minute, and I think you can get a very close. And the S-chip program, you know, I like Obama's plan of trying to get every child covered, because I tried to do the same thing in Wisconsin. I just don't know if mandates is the way to go. I'm not there yet.
I have two more questions.
Can I respond just quickly, because it's one of those rare things where we may have some disagreement. I'm not big on mandates either, but people ask me all the time, is health care a legal right? I don't think it's a legal right in this country, but it is a moral right. But along with a moral right, I think comes the need for individual responsibility. We ought to legislate at least individual responsibility. We do it for drivers who say they want to drive a car. We say, well, we'll give you a driver's license on a condition that you get insurance. We do it for homeowners. It seems to me we ought to do it for health as well. If that's the only way we can bring people to the realization that they've got to take individual responsibility. What's happening today is those who don't get insurance go to the emergency room and the rest of us pay. And that's called cost shifting, and we're cost shifting more and more on. This morning they said that one of the reasons why prices went up 10% last year in healthcare was that there is an increase in cost shifting going on from those who are uninsured to those who are insured. Well, we've got to end that cost shifting, and if we can take a page from others. Now, I agree Massachusetts hasn't reached 100%, but they're doing a whole lot better than most states, and they do a whole lot more better than that if they actually provided greater assistance to those who couldn't afford it. That's really the big problem they have today yet, is they still haven't reached that threshold of affordability for a lot of people who can't pay the price.